How to recognize an opioid overdose. This can be sometimes difficult and sometimes it's quite obvious. So it's difficult because some people naturally have a sedated state and they tend to be sleepy, especially if they're on high doses of this. So this is usually in the chronic users who are chronic pain patients or cancer patients who are on opioids, and it's sometimes quite difficult to tell. But the first thing is confusion, loss of their ability to speak coherently. There's also there could be some confusion. They may become unresponsive to voice, so yeah, you try to wake them by calling their name. If they don't respond, and that's a sign right there. Then painful stimuli is another way. So in the emergency room, we just take a knuckle and dig it into the sternum right here, which is quite painful if you try it on yourself. But a painful stimulus will wake a patient if they're not too deeply sedated. So that's how you recognize it in the earlier stages. The later stages is when the respiratory arrest occurs, so they're not breathing. There's lack of rise of the chest and fall of the chest. There is they may turn from normal skin color to pale to a green color or ashen, and then finally to cyanotic, which is a blue color, and that's obviously very worrisome. So if you see somebody who's blue, that's a serious emergency and call for help to give respiratory support by mouth-to-mouth respiration, and then a Narcan kit, and calling 911. How to prevent opioid dependence. So this again depends on who we're talking about. If somebody is on a prescription from their doctor, then following the instructions on taking the minimum possible dose is the best way to avoid dependency. So typically, for example, with Percocet or Vicodin, it's 1 to 2 pills every 4 to 6 hours. The idea is to start off at the minimum dose, so 1 pill every 6 hours. They could stretch it out to even every 8 or 12 hours. A little bit of pain is expected. I mean, we're on these medications because of a pain reason. So there's nothing to fear. Pain does not kill, and sometimes it's better to err on the side of caution. So dealing with the pain, learning how to deal with it without coping, depending on an opioid, is the way to go. So our society has become somewhat fearful of pain, and we need to learn how to embrace that, because there's alternatives aside from opioids. Preventing a dependency in somebody who is actively using. So I mean, the obvious thing is to minimize how much you're using and don't take excessive doses. But a lot of people, just like myself included, as somebody who's in long-term recovery, even though I know better, I kind of didn't listen to myself, and I kept going and using and using. So this comes from a harm reduction standpoint, and that is, if you are going to use, especially with opioids, to use no longer than 2 days at a time, and to allow a break of 1 day afterwards. So with an active opioid user who is going to use, and there's no doubt about it, then the smartest thing to do is to use for a maximum of 2 days and then allow 1 to 2 days afterwards. This is very hard to do because the opioids are so addictive and most people can't adhere to this. But if they are going to use, this is my advice not as a physician but more so as a fellow user or recovering user, is that the way to avoid dependency is to allow some time, a buffer between use. So again, it's if they're going to use for a day or two, and then allow a day or two off in between, and to adhere to that strictly. How to reverse an opioid overdose. To reverse it, respiratory assistance is needed if they have stopped breathing, but the Narcan kit, this is naloxone, the same drug, this can be given as an injection in the muscle or an intranasal spray. So that is the quickest way to reverse an overdose. Most importantly is to make sure that the bystanders are safe, that the person who has lost consciousness is laid down on the ground to help improve chances of not closing the airway, and then giving rescue breaths, and finally again Narcan, whether it's by intranasal or intramuscular injection.